of today's meeting, I would just like to make an announcement. We have only just heard today that unfortunately, Councillor Taverner, who was a member of this committee, who represented Hunts District Council, sadly passed away. So I would ask members if we can just have 1 minute's silence. Right, thank you for that, members. Members, you are by now aware the need to keep the video cameras switched on for your duration of the meeting. I do understand that there is 1 or 2 members who are having technical difficulties, and in those circumstances, we do allow members to attend with just their microphones. Unless there are technical issues, and to keep your microphone muted, except when I invite you to speak, please click the raise blue hand function if you wish to ask a question or comment. There is always a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare an adjournment while the fault is addressed, and the public broadcast will be paused. If it is not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Can I remind members that all virtual meetings will be recorded and that these recordings will be published on the Council's website. Members, I will begin by calling the names of all the members of the committee to establish your presence. Please unmute your microphone and confirm your presence when called. Councillor Bowden.
Thank you, Chairman. I am present. Unfortunately, I have some technical difficulties, which is why my name appears twice at the moment on the screen. And I also have to apologise that I will need to leave the meeting a little bit early.
Thank you. Councillor Connor.
Present, Chairman.
Councillor Lorna Dupre.
Present.
Councillor Goldsack.
Present.
Councillor Linda Jones.
Sorry, present.
Councillor Lucy Nethingser. Sorry.
Chairman, Councillor Netzinger appears in the list of those members of the committee, but as I understand it, the December reorganisation of committee places means that she is no longer a member of the committee. Perhaps officers could confirm.
That is indeed correct. That's she's left in there by.
Right, thank you for that information. Councillor Susan Van de Ven.
I'm here.
East Cambridgeshire District Councillor David Ambrose Smith.
Present.
Fenland District Councillor Sam Clark.
Present.
Huntingdonshire District Councillor Sarah Wilson.
Present.
South Cambs District Councillor Jeff Harvey.
Present.
Cambridgeshire City Councillor Nick Massey.
Present.
And of course myself, Councillor Hay. Can I ask Rhiannon Layton to update us on any apologies, please?
Apologies have been received from Councillors Hudson, Harford, Reynolds, Smith, and Huntingdon District Councillor Taverner. Substituting for them will be Councillor Goldsack and Bowden, and Councillor Wilson will be substituting for Huntingdonshire District Councillor.
Thank you. Does any member wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? A disclosable pecuniary interest will require the member to leave the meeting for the duration of any report declared against and not to take part in any of the discussion. Nobody, oh, sorry, Councillor Wilson, you have your hand raised.
They're not pecuniary, but I need to declare that I'm an ex-employee of CCS 0 to 19 service who provide the Healthy Child programme. And in regard with the COVID documents, I'm employed in the CCS mass vaccination centres at the moment.
Thank you for that. We are asked to approve the minutes of the meeting held on the 3rd of December as a correct record. Can I ask if any member who does not agree with the proposal to please use the raised hand function now? I can see no raised hands. And So on that basis, are committee members happy to approve the minutes as written? Yes? Well, I can see nobody objecting to that. On the basis that recommendation to approve the minutes is carried, I will sign a hard copy when we return to the office. The next item for noting is the minute action log, which was emailed to you all on the 3rd and also published on the council meetings webpage. I understand since the 3rd that the action log has actually been updated, and an email went out to that effect at about 18 minutes past 9 yesterday evening, and it has been published on the website yesterday. So I do hope members have had a chance to look at the revised action log. Has any members questions they wish to raise on the minute action log? If so, please raise your blue hand function on the right of your screen now. I can see no hands raised. So sorry, no members have indicated that they wish to speak, so we will take the action log as noted. I've been informed by Democratic Services that no public questions or petitions were notified during the Constitution deadlines. So we will therefore move on to the Healthy Child Programme, which is agenda item number 5. And I would ask, and I would like to thank Raj Lakshman, the Public Health Consultant, Team Commissioning Manager, and Helen Freeman, the Team Manager of Children and Public Health, for being here today. Raj, could you please provide a brief introduction to the report?
Thank you, Chair, for giving us this opportunity to present a report on the Healthy Child Programme, which is health visiting and school nursing service, which is one of the Public Health Commission services. And this report talks about...
Apologies for being late, everyone.
This report talks about the impact of COVID-19 on the Healthy Child Programme, the challenges faced and the changes and adaptations made during this time, and the service performance and a way for how we look at it in terms of future steps. And the committee is asked to note and comment on the actions being taken to support children and young people and families during COVID-19. This report is co-written with the service leads for the Healthy Child Programme, because we have a Section 75 agreement, which means that we work in partnership with the providers as commissioners and providers. And in summary, we've got the summary in 1.2, is that we've introduced a new telephone number called Call Us to improve access to the wider set of support services. We've seen a growth in families accessing support via the expanded Text Us and online offer. We can report that we've maintained the 5 mandated health visitor contacts throughout, and there is some face-to-face support as well based on clinical triage. And we've had an increase in the Universal Plus and Partnership Plus elements of the Healthy Child Programme, which is the families with more needs. And we've looked at other ways of supporting families during this period. So as I said, this report covers the whole of the Fight Not to 19 Healthy Child Programme, which is delivered by Cambridgeshire Community Services and Cambridgeshire and Peterborough Foundation Trust. As an integrated service, there is a single integrated senior leadership programme, a team across the service, and it links very closely with the Best Start in Life program, which is where we are bringing together an integrated service for 0 to 5-year-olds, which includes early help, midwifery, early years education. So we'll touch briefly on that. So in terms of what happened during the first phase of the lockdown, that's moving on to 3.1. during the initial prioritization measures during the first phase of the national lockdown, there was a requirement to prioritize the antenatal visit, the single point of access safeguarding work, and family nurse partnership. Would it help if I shared my screen, or is it fine to be going through? I can pick up the points that I'm talking about. So this is 3.1. And in terms of that prioritization, there was also a requirement that some of the staff may have to be redeployed to support the acute response. Fortunately for us in this area, there was no redeployment required, and we maintained all the complete staffing for the Healthy Child program. And this meant that we were able to offer some in-person support as well as virtual support, and there was an overall blended offer for families based on clinical need. And especially within the family nurse partnership and linked to that, the enhanced young parent pathway, there were a higher amount of contacts delivered in person, and also in the universal partnership element. And we can see that there has been an increase in the amount of text messages and online calls received for the service, because a lot of the other services were not operating during this time, like the children's centers and some of the other informal networks were not available. As I said, we worked very closely with midwifery and children's centers and early years and early help services. In phase 2, which is the NHS language for recovery and restoration, we did see a lot of an increased level of parental anxiety, infant feeding issues, and requests and parents getting in touch for more support in terms of infant feeding and help with toileting. We also did see more calls for domestic abuse, and these were all addressed. And although nationally there were reports of increased non-accidental injuries in babies, we did an audit that we conducted did not show that this had increased in Cambridgeshire and Peterborough. And we found only 9 babies out of a total of 6. That's also high, but it was not high compared to national. In phase 3, which is recovery and restoration to date, a letter was issued by the Chief Nursing Officer calling for Healthy Child program to be protected. And nationally, there was a recognition that the importance of the Healthy Child program was recognized. And during this phase, there was a clear mandate that there should be no redeployment of staff, and which has been maintained. As we all know, the Healthy Child program consists of, moving on to 4, this is Universal Offer, Universal Plus, and Partnership Plus. So in terms of the Universal Offer, we've got the single point of access and a digital offer, including the website, which is a gateway for parents to get in touch with the Healthy Child program. And we've expanded that quite substantially. As you can see from some of the data that's been presented in terms of access to single point of contact and chat health and the text us service. So chat health is for children and young people aged 11 to 13. Again, we can see that whenever that's marketed or promoted, you get an increase in contacts. And the good thing that happened during this period was the emotional health and well-being service joined in with the chat health to provide a more comprehensive, because a lot of the calls or contacts to chat health are for mental health issues. So that was one positive that came out of working together with other services. So it was an integrated point of access for all the specialist services as well as the Healthy Child program. In terms, moving on to 4.3, in terms of digital development and self-help, again, we can see that the website has been developed and seeing an increasing usage with in excess of 10,000 users now. And organizations across the system came together to share and promote this via lots of social media platforms, as well as the online offer that was there. In terms of moving on to what we actually report on usually to Health Committee, which is the mandated health visitor contacts, which we report every quarter to Health Committee. Section 5 on this, we can see again, I don't want to go into details, but happy to take questions so that we leave some more time for questions. We can see the antenatal, the new birth visits, and we've put in some qualitative and quantitative data to sit alongside to give you a fuller holistic picture of how the reviews have been working. Again, just to stress, these are targets that we've set locally. There are no national targets for the Healthy Child Program mandated contacts. These are targets we have set for ourselves. And when we look at national data, we always seem to do well compared to national. So although we report that we're not meeting all the targets, one is compared to nationally, we do well. And secondly, when we add in the exceptional reporting, which is when we add in the people who did not want or did not attend in spite of being offered a contact for the 1 and 2 year checks, then the percentages go up substantially. Also to reassure Health Committee, children on the Universal Plus and Partnership Plus are always prioritized in terms of making the contacts. Again, moving on to section 5.6, we can see that the method of contacts has changed in terms of there's more telephone contacts and face-to-face in-person contacts are less compared to March, if you can see. And video consultation has been introduced as well, which through Attend Anywhere. In-person does happen based on clinical need and after a risk assessment. And when it's done with full PPE. In terms of the Universal Plus and Partnership Plus activity, moving on to 6, the main contacts are for maternal mental health, parenting support, sleep problems, enuresis, and behavioral and mental health problems for the 5 to 19. And we can see that compared to the light blue and light green are the lines for 2019. And you can see that is higher now in 2020. So a lot more work moving from universal to the higher end needs. And again, it just shows the different contact methods, and I won't go into any more details, but again, I'll take questions for.
Thank you, Raj. If you're finished.
Yeah, that's fine. Yeah, thank you.
We'll now move on to questions from the committee. Before we move on to those questions, I will stress that Raj has another committee to attend following on from this. So can we please try and keep our questions short and to the point? Thank you. So members, if you wish to speak, please raise your function hand. And when I invite you to speak, please turn on your microphone. Right, Councillor Lorna Dupree.
Thank you very much indeed. I've got 3 questions, if I may, about this report. The first one is a general question about the whole of section 3, really, and the phrase, the heading recovery and restoration, which occurs in several places and which I understand to be a sort of a national NHS template, as it were, for itemizing the response. I'm somewhat surprised at that because that looks remarkably linear as if we had a pandemic and we're now coming out of it. And that's not been our experience. We are in the second wave of the pandemic. And my understanding of the pandemic is that it is likely that for at least another year or even two, we are likely to see a kind of a cyclical picture whereby things will lighten up in the summer and then get worse again in the winter, and we may go through at least one more cycle of that the following year. So is the NHS reviewing nationally that oddly linear approach to what it seems to me is going to be a cyclical issue, is my first question. Then I've got two questions specifically on section 3.2. The first one is we have heard nationally about the increase in non-accidental injuries in babies, which has been reported nationally. We then see in this report a description of what has been done locally to look through records and try to follow that up. But the wording is ambiguous. It doesn't specifically say whether or not there has been that increase in non-accidental injuries in babies locally as well as nationally. And I would like to know a little bit more about that, because that seems to be slightly data free, other than in terms of how many records were looked at rather than what the outcome was. My other question is in the following paragraph of that section, which is about in-person support in children's centres. Well, we know that we've lost a number of children's centres, and that what we have left is now very much concentrated in urban areas, requiring people from surrounding rural areas to travel to them. And that is water under the bridge to an extent, but with lockdown, with public transport either being reduced in scale or people being nervous about using it, does that not mean that the opportunity to access in-person support where it could be useful is actually reduced for people who can't make their way on foot to the urban centres that remain or haven't got a vehicle? Thank you.
Thanks a lot. Really very important and questions, Councillor. So the first bit about whether the NHS is going to change its phraseology, totally get it that this pandemic has shown us that we cannot predict what's going to happen. You can have new variants and new strains, and all plans change. So I'm not aware, I'm not fully informed of what the NHS is planning to do, but I know we've had to again go back into lockdown and go back into the NHS going into the first phase of, and the second peak is much worse than the first wave. And yes, you're absolutely right. We don't know what will happen come the next winter, come summer. Without, there's lots.
Oh, we seem to have lost Raj temporarily.
Yes.
I'm wondering if I could help you with the second two questions while we wait for Raj to come back. Is that okay?
Thanks very much, Helen.
In terms of the non-accidental injuries, actually just this morning we had a kind of a meeting with our providers, and we made sure, like we do in all of our conversations, that we check in to see if they're seeing any differences or if they're still seeing the same level that they would expect in terms of those coming through. They've reassured us again today that they haven't seen an increase locally in terms of non-accidental injuries. In terms of kind of the actual data, if there is a kind of we haven't had numerical, we've had kind of conversations which they're monitoring, but I can see if we can get any of that information. We've been introducing something which is mentioned in the paper around ICON, which is a method of supporting new parents around kind of dealing with some of the feelings they have around babies crying and supporting in those early days. And that is due to be being reviewed in the next couple of weeks, and we're going to be linked into that to find out how it's being used and how practitioners are kind of experiencing that. But yeah, it is something that we are aware of because of other areas, and we're checking in regularly. In terms of links with the Child and Family Centres offer, Raj mentioned earlier that throughout this pandemic, obviously, we've been working really closely across the system, working with our colleagues across maternity and child and family centres to look at, to make sure we have a really full understanding of what the offer is. The Child and Family Centres have been really quite creative in terms of lots of development of their virtual offer, which actually does help for a lot of that rural communities in terms of access. I know they've also been making sure they're being able to identify those families that they have particular concerns about, and have been delivering to homes things like hygiene packs, activity packs, etc. And I believe that they have been putting together a report on that activity over the last little while, which I think might be going to CYP committee, but I could see if we could kind of get that information to you.
Okay, thank you very much indeed.
Thank you.
I
Thanks.
think
Lorna,
Raj-
did that fully answer your questions, Lorna?
I'm sorry, Chair.
Did that fully answer your questions?
Well, Raj was still, I think, not quite concluding on what the NHS might or might not be doing about reviewing that linear approach to a cyclical pandemic. I don't know whether the Director of Public Health has any comments on that.
And I can come in on that if helpful, Chair.
Yes, please.
Yes, so clearly the NHS has to deal with the complexity of fully managing COVID and COVID patients, but at the same time trying to minimise the negative impacts of COVID on other illnesses. So I agree with you, Councillor Dupre, that this is to some extent cyclical. It's not linear, and we have the vaccination programme coming in, which is positive. We have the new variants, which we have to work with. So it is a permanently changing picture, but really the NHS focus has to be on maintaining as much as it can of its normal business, while at the same time managing COVID alongside. And I think that's really what the NHS is doing. It's not a sort of linear COVID then recovery, but it is as people have sometimes phrased it, the new normal, which is very much what has to be done. So I hope that's helpful.
It is helpful. It does worry me because language is important in determining behaviour, and it seems to me that the picture will not be as linear on the ground as the wording suggests, but I'll leave it there.
Accepted, yeah.
Thank you, Liz, and Helen for standing in there. I believe we're still having problems with Raj, are we, Daniel? Daniel, are you there?
Sorry, Chair, I couldn't get unmuted. Yeah, she doesn't appear to be back in yet. She came in briefly and then bounced back out again.
Right.
Can't get hold of her.
If we carry on with questions, I'm sure Helen and Liz will do their best to answer any, and any that they can't, obviously, will have to be taken away, and we can get a written answer afterwards if everyone is agreeable to that. So the next person who wishes to speak is Councillor Linda Jones.
Thank you, Councillor Hay. And I have one or two detailed questions that I think I'll leave and ask Raj separately and focus on a couple of key points. I mean, the paper is immensely helpful because it demonstrates the kind of range of pressures that there are and the demands that there were on the various services. And although clearly the services have not met informally or locally set targets, it's not surprising they have. And they have shown the ability to kind of bounce back. One of the aims, which I think is there on page 20, was to create a wholly integrated skill mix model for Cambridgeshire and Peterborough. And that obviously is a work in progress. I guess the only part of the paper, and this is not a criticism, but part of the paper that I'm slightly disappointed about is the learning. And that may be to do with the fact that, as Lorna, as Councillor Dupre has pointed out, we're still in the middle of this kind of crisis. But in a way, what I'd be interested in, if Helen can respond on this or Liz can, is what's the learning so far that we're taking into this third phase of the pandemic? I mean, there are clearly messages there about the increased demand for Partnership Plus, for Universal Plus and Universal Partnership Plus. That's a strong message coming through. Is that continuing? There are strong messages in section 6 about demand for continued support for breastfeeding and the fact that's gone up, not surprisingly, and in particular a concern there about young parents. So are there other issues that you see as being able to respond to and, as it were, do better in phase 2? And the other issue for me is about the integrated working, because what you can see across this paper is a plethora of meetings, a kind of growth of all sorts of meetings and things happening all over the place all the time. But what's the learning that's being done from that? Are these going to stop when COVID finally goes away, or is this moving toward this model of more integrated working that is going to be able to survive what essentially is crisis management? Thanks.
They're really good questions, Linda. Thank you. I think in terms of the learning, it's really interesting because I think during the first few months, the learning and the practice, it was very immediate. We've got a problem. What's our best guess? What can we put into place? How do we very quickly go from being a predominantly kind of face-to-face, clinic-based service into something else? And so it was almost very reactionary. We need to put something in place. How do we do that? As we've been moving through, I think a lot of the learning has been very much about the effectiveness of various parts of that offer with various groups. And one of those areas you highlighted was around the number of parents who are contacting us for support around infant feeding. So we kind of had lots of people calling, we had lots of contacts with people, and it felt like that offer was working. What we realised was happening was lots of parents were then calling back for a second or third time. And so what we've introduced is more face-to-face clinics with PPE where necessary. So we can do a single kind of conversation with somebody and then move on. The other thing we've noticed around that is a lot of people are contacting us with a particular health concern. That might be about infant feeding or development, but actually the issue is around anxiety. Can I just check that people can hear me? Because everybody on my screen is frozen. Are you actually, am I okay for people to hear?
Yes, you're fine, Helen.
Brilliant. It's just that I can't see you moving. That's okay. In that case, I'll carry on. So we are kind of realizing that parental anxiety is often be underneath a lot of those reasons, presenting reasons why people are contacting us. So we know that there's only so much we'll be able to do about that. A lot of that is coming from the fact that peer group support isn't there in the same way that it is in a lockdown. The support that people are getting from kind of wider families, extended families, isn't there. So we're looking into how we can continue to work around supporting parental anxiety. And things are like the icon, I think, is helpful in that. But it's just being a little bit more aware that when somebody is contacting and saying, I need help with infant feeding, to make sure we're also opening up those conversations about somebody's mental health, their anxiety, etc. So those kind of learning is definitely coming through. In terms of the bit around integrated working, that's really interesting because we have added in, as you say, lots of different kind of groups and meetings and feel more efficient than we had before because we're using kind of Teams, etc. So we're able to have quite a lot of regular informal catch-ups as well as kind of those other more formalized meetings. And what we've got real improvement in terms of understanding and relationships across the partnership. One of the documents that we've kind of linked to this paper is a new piece of research that's out that has been looking at the first kind of from the first 1,001 days, looking at the learning around how those parents have children from kind of pregnancy to birth have been affected and how agencies can work together. And they kind of really pull out the fact that that relationship building across the piece is really important. Now, we're very fortunate that one of the authors of that report and from the ISOS partnership is somebody who's helped us with Best Start in Life. So we're going to work with them to see if we can use that report as in terms of an audit tool to check how our kind of system-wide approach is working against what they've seen to be best practice, and to make sure that we can continue to develop that integrated working moving forward. And we're in discussions around how that links to the development of integrated care systems moving forward. I'm glad to say everybody's now moving on my screen again, so I'm feeling a bit more.
And I'm glad to welcome Raj back. Thank you, Raj.
Yeah, I'm really sorry. I don't know, there's an unstable internet connection. I've managed to get back in.
We all have it. Linda, did that answer your questions? Because you did have one or two others, I understand.
No, it's fine. And I mean, Helena's done extremely well. One of the interesting things I think that she's talking about, and it seems to me it's a big issue across this committee, other committees, is the whole latent need issue. And it's the fact that people present with one issue, but actually underneath there are a lot of others, and the issues are more complex. And it's something I was trying to draw attention to in relation to adult care, because I think it's coming up there too. So it's a really interesting issue going forward. And it's good to see that, you know, a lot of learning is being done. Thank you, Helen. And thank you, Raj.
Thank you, Linda.
Sorry, yeah.
We will now move on to Councillor Sarah Wilson. Sarah, you're on mute.
Thank you very much, Chair. The first thing I'd like to say is I just think the staff need to be congratulated on achieving just how much they have achieved, because it must have been incredible. Well, it still is incredibly difficult for them. And it is unpacked slightly in the report, but I would be interested to know how the staff are actually feeling on the ground at the moment, because my gut feeling is it must be incredibly tough. My second question is about during lockdown, I think there are a percentage of children who are not having, a small percentage of children who are not having the life experiences conducive to achieving their potential. And I'm wondering what thought is being put in to try and find this little cohort. A lot of children will have thrived having their parents at home, but a lot of them will be really struggling, and it's finding these children. And I'm thinking about the 1 and 2.5 year checks being incredibly important so that we actually do see these children. And I know it's lovely to adjust the figures through exception reporting, but it always worries me that that 15% includes the 3% of kids that they're the ones that we actually need to find who are not having a good time during their first 1,001 years. We didn't talk about, moving on to 6.3, sorry, I've got a few questions. Talking about the SEND support. This then follows on. I've had contact that the Liquid Logic system for referring on, and it isn't mentioned in this report, but is key to the SEND process, is actually restricting referrals because staff find it incredibly difficult to manage, to the point that it's something that they try and avoid if possible. And I'm wondering if there is some thoughts about Liquid Logic. And there are no figures in this SEND section, and I'd be really interested to know if there are more children being identified, less, or what the thoughts are about the few children. You know, are we finding these children who are not achieving during lockdown as yet? And just a final point on chat health. I think that averages out about 15 contacts a day, which is lovely, but it's actually not many at all if you think we're talking about a secondary school population of a huge secondary school. It's still only a very small percentage. It's great that we're getting 15 more than none, but it still only is a very tiny figure, and doesn't represent what we were contacting before in previous times. Thank you.
Thank you, Councillor, and thanks a lot for acknowledging the amount of work that the health visitors, school nurses are putting into delivering the service, it has been very, very difficult, as you've recognized. And I think there has been a lot of anxieties, low morale, and I must say that our senior leadership team is very good at managing the situation. And thank you for acknowledging that. That was the first question. As I said, we have had staff resignations, we have had low morale, but the senior leadership team is managing that. We've had to use more bank staff as well. In terms of some group of children not having the life experience that they should have, and those are the ones we're most worried about, you're absolutely right in that, and which is why we always say that the health visiting service or the 0 to 5 service is the only service that is the ears and eyes on the ground of, which is because it's a universal service. And that's why we have maintained that target of 90% in spite of it being a very difficult and challenging target to meet. So we are trying to get to all the children that that we should be getting to. In terms of improving their life experience, I think it's going to be difficult for this whole generation of children as they go through this. We've been doing communications, and the website talks about living through COVID, and we're trying to do all that we can in terms of working with John, that's the Director of Education, putting out stuff to parents through the schools medium, which through the heads and emails and information through parents. Liz, our Director of Public Health, has talked about various things. Now for half term, for example, we are putting out something about how parents can safely enjoy half term with their children, even while following the rules. So we are doing a lot in terms of communicating with parents and giving them through the community hubs and the rapid response teams as well, what's on offer and what can be done while following the rules during the pandemic. And in terms of SEND support, again, that's a useful point. It hasn't been highlighted to us that Liquid Logic is a barrier to referrals, but we can definitely go back and check with the providers, because that has not come to or not been highlighted to us. But I don't know, Helen, if you wanted to add anything.
No, we have checked in to make sure that the processes for that identification of SEND children and the referral onto the early support pathway is still happening, and that is. I think, as Raj was saying, it is more difficult to identify all of the need out, which is why it's been so important to work across the system to kind of use every touch point we have. I guess there is a worry with also fewer children attending early years. I know early years centres are still open, but lots of parents are kind of keeping children at home. That there may be children who don't have those usual eyes and ears on them from their early years practitioners at those kind of crucial ages of 2, 3, 4. So we may see some impact in terms of later identification of some of those SEND issues, including autism spectrum, etc. But that would be difficult for us to see at the moment. So that would be something that we really need to kind of continue to work with our education colleagues on as we move through this, particularly kind of just acknowledging that there hasn't been the same number of eyes on our children, which is why, as Roger was saying, we've been so fortunate at being able to keep as much of our Healthy Child programme in place as we have without having to do that redeployment, so that we can at least offer those 1 and 2 year checkpoints to families who may not have been seen by any other services.
Right, Sarah, are you happy that your questions have been fully answered?
Yeah, thank you. I think it would be beneficial if there could be a little bit more thinking about the Liquid Logic. If that is possible, I'd be grateful. Thank you.
Yeah, no problem.
I'm very much aware that Raj has to go in about 5 minutes or so. So if we can, I'll stop any more people putting their hands up for questioning. I think we've got Mark, followed by Susan.
Well, I'll be very quick. I have a point and an observation. The point is I'd like to thank the authors for, it's very difficult sometimes subbing at a committee meeting. This report made it very clear and very widely understandable. The debate has added further colour to it, but it was very good for that. However, if you could be so kind and look at 2.1, and I'm sure Steve Criswell and Adrian Chapman and the CMP committee would be very pleased if you would change Think Communities to Cambridgeshire Local.
Thank you. Yes, thank you. We will do that. Thanks for pointing that out, Councillor. Thank you.
Thank you for that, Mark. Susan, if you'd like to put your question.
Very much. Yes, I also wanted to echo the thanks to staff. I mean, it deserves a section of its own in the report, and it needs to be not just acknowledged that staff have done an incredible job in incredible circumstances, but I think we also need to take stock of recording that. And I mean, you mentioned, of course, there will have been resignations and of course we'll have needed agency staff. I think it's important for us as a committee in appreciating the whole picture and where we are headed and mapping out the future to understand those things in a kind of dispassionate way noted in the report, and realize that's difficult to ask officers to write that about their own, these are your lives. So yeah, so make a couple, just those points. And then it occurred to me, you have some very nice comments, which are really encouraging about how well some of the new adapted services have worked. And so the feeling of a case study is always useful. And I remember at the Health and Wellbeing Board, we've sometimes had, we would often open with a case study. And I wonder in this realm, if we could also have a picture of some of the difficult casework, for example, around internet poverty and the difficult to reach cohort, the small cohort, but how are we actually tackling that kind of casework? And that would give us sort of, a more difficult picture. Sorry?
Can I interrupt you a little there, Susan? I'm not sure lack of internet is something that is the responsibility of public health.
Sorry, I didn't mean that, Anne. What I meant was there are references in the report, of course, in the importance now of virtual communication, where we have whatever we want to call it, digital, hard to reach. I mean, there are many terms, but we have a cohort there that can't partake for whatever reason. And it would be good to understand more fully that kind of casework and how we are able to deal with it or not, so that we have a fuller kind of honest picture of that, and we're aware of course, the consequences that we'll need to be thinking about in the future. So I'll leave it there because I know your time is limited.
Thank you, Councillor. Just to say on the point about case studies, we do have case studies every time we have a quarterly contract monitoring report meeting with the providers. We do have quite a few case studies that they bring so that we get the qualitative stories as well as to see the impact, not just on the numbers, but through quite detailed case studies are submitted by the practitioners, which give quite a very good in-depth insight into how families are coping and lots of different issues that they have to deal with during these conversations. So that happens at we had our contract monitoring meeting this morning, and we had case studies that we went through. In terms of internet poverty specifically, we can ask, and I'm sure there will be practitioners who may have had that, and we'll look at that when we have our next meeting with them. But we can definitely ask the providers if if any of their staff have come across any case studies. But again, I don't think we can put individual case studies in the public domain. So,
and I think adding to that, as well as I know there's been lots of work to kind of support people to get the internet access they need, and our young people. But we're also very aware that there are a cohort of people who don't enjoy being supported via that online offer. We've had kind of a mixed picture in terms of supporting some of our young people that way. Some young people really like it. It suits the way they live their lives. Other people find it quite difficult, particularly things like the video conferencing, those young people who have issues in terms of self-esteem or body image. We're aware that there are also limitations on that. And I think the challenge moving forward will be how we can take some of the great learning around how we can integrate some of this video platform, because for lots of our families, it works really well. It's very flexible. They don't have to travel anywhere. So being able to take some of that really good part of it into our offer moving forward, but making sure that it isn't this is the only way you can access our service. So being aware and not making kind of, I think earlier on I'll be assumed all young people would feel happy with this media. And as we've kind of moved forward, we're seeing nuances within that. So it's really interesting, really fast learning about kind of how we use this and the limitations of that. But I also just wanted to kind of thank everybody who's kind of acknowledged the staffing in this, and we will make sure that we pass that back to the providers. On a kind of a positive note, they have been working really hard around kind of what this means in terms of forward recruitment, and there's active conversations with Anglia Ruskin University around having working more around the career pathway, about looking at how we can be taking staff from Band 4 through to registered nurses, through to the Band 6 role, to how we can kind of have a work on that re-recruitment into those, making it a much more stable workforce moving forward. And all of the kind of the restructure that came with the new contract is all completed. We've got a much more stable management team now. So we don't think we're over all of the bumps in the road, and we know that it's a very tiring time for staff. So we're not kind of saying that we've got it cracked, but there's definitely kind of work happening to address that.
Thank you for that. I must admit, I have one very quick question I would like to ask, and it's to do with vision screening. I noticed that by agreement, there was no attempt to do any school screening of vision in the autumn term, and instead a decision was taken to focus on the community clinics. Have we seen a drop in the number of children being picked up with problems with their vision? Yeah, what I'm trying to find out is the fact that we didn't do school screening, what effect has it had?
So yes, I think that is another concern. That is another thing that we are concerned about. We're working with CUH, the hospital, about they've got a digital platform to do vision screening when the face-to-face can't happen, and that's just going to start to be rolled out in terms of picking up those children that we couldn't do earlier. So there's lots of developments in vision screening as well in terms of the digital DigiVis, which is something that Addenbrooke's have developed and which we are piloting and rolling out gradually across the county to pick up these children with who we may have missed, and that's a point that is well made and we're very aware of.
Thank you, Raj. I think we've asked all the questions that we wish to ask. So we are asked to note and comment on the actions being taken to date to support children, young people and families during the ongoing coronavirus pandemic. This, I believe, that we have done. So we'll now move on to the next item on the agenda, which is item number 6. which is the COVID-19 issue report. This report was circulated to the committee on an email from Democratic Services and published on the agenda page website on the 9th of February. I accepted this as a late report on the following grounds. The reason for lateness: to allow the report to contain the most up-to-date information possible, and for reasons of urgency, to enable the committee to be briefed on the current situation in relation to the Council's response to COVID-19 for those services for which it is responsible. Can I now ask Liz Robin, the Director of Public Health, to introduce the report, please?
Thank you, Councillor Hay. And you've all received and read the report, so I won't go into too much depth, but I think standing back since our last meeting of the Health Committee, we have seen our second wave of COVID-19, both nationally and locally. So locally, our COVID cases, diagnosed cases, peaked on January the 4th, at a rate well over 500 cases per 100,000 population. Then with the effects of moving into Tier 4 on Boxing Day and moving into lockdown on January the 5th, we have seen a good decline in cases. And that has followed the national pattern and has gone relatively well. And during this period, our cases have remained below the national and East of England averages, which is a positive point. But I don't want that to subtract from the overall impact of the second wave. We have had more cases, more hospital admissions than in the first wave. So our hospitals have been under real pressure. And we have also seen, sadly, an increase in deaths, particularly in January. And you see the statistics in the report, which show the sad impact that the second wave has had on our local residents. But it is positive to see those rates declining. We also have a picture at the moment. I haven't included the figures for Peterborough, but we know that Peterborough has been slower to decline in its case rates than Cambridgeshire, probably due to some demographic factors around a young population and many people working on the front line. And we've also seen a slower decline in Fenland as well. So Fenland rates are above the national average at the moment. And that does share some of those factors of many people going out to work, and also quite a significant older population at care homes and so on. So we are seeing variation around the county, and actually the lowest rates at the moment are in Cambridge City. But all areas have seen a fall. So that is a description of the course of the pandemic over the past 2 months since our last meeting. In terms of key national and local developments, clearly the absolutely key national development has been the vaccination programme, which is going well and is a rapid vaccination programme with a huge effort from our NHS to implement this. It's been an absolutely massive coordinated effort. And locally, I'm pleased to say that we are now doing well on our local vaccination statistics for our over 80s, over 75s, over 70s population. A slightly slow start, which you will have seen in the media, but now we are doing very well. And our model is working well, working across our primary care networks, our large-scale vaccination centres and our hospitals, and just in a pilot sort of early sense, pharmacies as well. So that is positive. There's recently been a letter which is important for us as local authority from two secretaries of state. So it's from MHCLG, Ministry of Housing and Local Government, and also from the Ministry for Health and Social Care, Department of Health and Social Care, jointly signed letter outlining the role of local authorities in the vaccination programme. And we have, of course, been doing everything that we can to support. But it's very good to see that the role of local authorities in supporting going forward identification of vaccination sites, helping accessibility, helping people reach their vaccinations, our role in communications and engaging with our vulnerable communities, which local authorities do so well as our role in ensuring that care staff are vaccinated. All of that is picked up in this letter and the responsibilities given to local authorities. And a key message is that this is a very strong national programme right now, but it will last going forward, and there will be an increasing local focus and our ability to support it locally, particularly around that last 10%, that last 20% that you may see of people who don't get vaccinated, who we need to work with to engage and support to their vaccination. So that is absolutely key at the moment. We're also seeing national news around new variants and ways to contain those. And just to reassure you that we are learning from Hertfordshire in their response to the case of South Africa variant that they had, the way they mobilised their community into testing. And we are learning the lessons from that so that if anything like that happens in Cambridgeshire, we have plans in place. Moving on to very much the local response and specific things we're doing locally. I would like to emphasise the work that we're doing with district councils at district and city level. There is a weekly COVID Gold, which is usually led by the chief executive of the council or a senior leader. We join in those meetings with our epidemiology, with news of what's happening in our wider outbreak control services. There's usually other local partners there. And those district and city level goals are able to really respond to the local epidemiology, the local soft intelligence, and to deliver prevention, rapid response and support for people who are self-isolating or vulnerable. So that's really developed well, and I'm very grateful to district and city colleagues for that. We've also put a lot of work over the last couple of months into developing our local rapid community testing service. So this is very much about delivering lateral flow tests, these rapid tests to people who do not have symptoms. Anyone with symptoms of COVID should still go to the drive-through and the other sites which have been operating for PCR tests. But we now want to ensure that, particularly at the moment, people who are going out to work during lockdown have the opportunity to be screened twice weekly with these lateral flow tests, even if they don't have symptoms, so that we can pick up cases early and help to drive down rates in our workplaces. And that includes in our early years settings, who've been very keen to take up this offer. So by the end of this week, we will have a rapid testing site open in every district and city area. And we're also engaging with workplaces to put that local programme and local support in place alongside a national programme. And I'd encourage you all to publicise that. On contact tracing, I think we have been developing our contact tracing offer and ensuring that it is stabilised. It's across Cambridgeshire and Peterborough, across organisations, but we're making sure we've got that core of contact tracers. Because as we move forward and as the rates of COVID come down and society starts to open up, we need to have a very sustainable testing and contact tracing service which works locally. So we are really working to make that sustainable, to assess the workforce and operational needs and to get those services running well. And in terms of your responsibility as a committee, to some extent that means that we're turning from a directorate which is almost purely a commissioning directorate into an operational directorate, which is running contact tracing, which is running the lateral flow testing. So that is we came into the council in 2013 as quite an operational directorate running smoking cessation services, weight management services and so on. We moved to a commissioning model where we outsourced that, but now we're becoming operational again, running some of these services as we respond to quite a rapid national direction, which moves quite swiftly. It's very developmental, we need to change things quite rapidly. So we want to keep that in-house for the moment while we develop these services. So quite a change in terms of what you're overseeing in that sense. I think I'll really, those are the main things I need to say. I would just come out with the absolute key message to you and to our residents, which is that we are seeing this positive change with a decrease in cases. That's slowing down a little bit now as our rates get slightly lower. But when you think about where we are with our cases, and you have the table, which is a couple of days out of date, but hasn't changed much, a rate in Cambridgeshire of 186 cases per 100,000 people. That is more than 10 times higher than our rates back in summer and early autumn. So we still have a lot of COVID in our community, and it's imperative that we still stick to those lockdown restrictions and really drive down those rates absolutely as far as we can, so that when we reach the point of relaxation of restrictions, we are in the best position to keep those rates down through the control measures that we can put in. And I can't emphasize that enough. So I'll finish there, and thank you for your time.
Thank you, Liz, for that. Would any members of the committee wishing to speak, wishing to ask a question or make a comment, please use the raised hand function at the right of your screen to indicate this. And I notice we've got a few hands raised already. So Susan, if you would like to start.
Thank you, Sharon. Thank you, Liz, for your report. And could I just say, as a South Cambs councillor, how much your participation and your team's participation in the community's duty regular briefings for the community support groups, how well that's gone down and how effective, because I see your messages being filtered down to the most local level, and you see them imparted word for word at parish council meetings and so on. So that, and in parish magazines and the work. So that's been really good to see. I just wanted to ask about the 3.2 in the education cell. And of course, the situation now is quite different from what it was before Christmas, when we had sizable outbreaks, I think, at a number of schools, and it was really difficult to provide the kind of direct support that would have been ideal. We just wasn't possible. And we know from our weekly briefings from John Lewis that schools, even though they are only partially open, there is, as you say, a lot of COVID in the community. I think those are words to remember. How are we? What is the capacity like in our education cell in meeting the current state of COVID in schools, if I may ask?
Okay, thank you. Councillor Van, sort of appreciate your comment about the messages getting out into the very local areas. That's exactly what we want to see, and district council level and links with community have been fantastic at keeping that momentum and getting the messages out. In terms of the education cell, that really is a joint effort. It's a pity Raj and Helen aren't still here with us. The capacity there is very much a joint effort across the education team, with staff who have really developed their knowledge and understanding of school risk assessments, and the public health team. Raj works very closely with John. Helen, who was here just now, supports the education cell, as do a couple of other public health staff. And we all work with the schools to support the heads and the staff who themselves are gaining their own expertise in what to do when you have cases or outbreaks in the school, the preventive measures to take and so on. So it really is an absolute partnership across the education cell and the schools throughout Cambridgeshire and Peterborough. So I think the The cell is at the moment continues functioning. It's working closely with the early years settings. It also has a link to the universities, and it is linking with the schools which are open because they're supporting key worker children. So that work continues. The workload may ramp up again, and we do have a cohort of staff in place to help support that from the council that work effectively, and a cohort of staff in schools who understand what to do. So I think I can assure you on that. And in fact, I would say that there is also a Department for Education helpline available to schools, but we have chosen to provide the support locally because both the schools and the council feel that that is the best way to provide it. So we are going above and beyond in some senses, but hopefully that support is working for schools.
Does that answer your question, Susan? Yes. You're muted, Susan.
Yes, thank you very much.
Right, we'll move on to Councillor Linda Jones.
Thank you, Councillor Hay. Thanks for this report, which is very helpful, and I was very interested in your final comment, which I think absolutely sums up the issue, which is that public health has had to move from a commissioning to an operational role. And what you can see all through this report is things that start nationally that then get handed down, and in the end it is at local level that they have to be delivered. And there are a couple of sort of slightly depressing moments in this report, I think, one of which is where you were doing the local backward contract tracing, and I remember talking to you about this. And then that had to be abandoned because there was more work to be done on forward contact tracing, as it were. So, there's a whole sort of set of things. And I think one's felt depressingly at times through this pandemic that things that have started being great national drives forward have ended up being bailed out by local authorities. And I think that the public health team has been absolutely core in relation to this. I think it's been really important. One of the things I think maybe we need to go back and look at is the resources, because I know you've been able to increase resources, but it seems to me compared with the sheer volume of work and the extent of work and the extent of delivery that has to come from public health, it's got a pretty raw deal, not just in the public health grant going forward, but as I recall, the first thing that primary care negotiated when the vaccination came along was a per capita payment for every vaccine given. Now, public health has done a lot around vaccination, not least in communications, but also in support and all the rest of it. And it really hasn't actually had very much delivered in terms of support. So sorry, this is, this is a bit of anger coming out here, really, that there are the fantastic local public health teams across the country, and our particularly wonderful public health team in Cambridgeshire, really, I think, needs more support and resource going forward. Because in the other part of this is the springboard to demonstrating how fundamental public health is across the whole health and care system and how it should have a central role. So thank you very much to you and the team for the work. Even if as I say, it seems to me to have to be so reactive at times.
Okay.
Thanks, Anne.
Thanks, Linda. The next person to speak is Councillor Goldsack.
Thank you, Chair, and through you to Democratic Services, listening to the excellent report from Liz, I apologise, I maybe should have just declared a non-pecuniary interest at the start of this. I am chairman of Salem Rangers Football Club, which is the housing for a lateral flow test site. So just please, if you can just make that note, I'd be very grateful. But just touching on that and watching that develop at a fast breakneck speed and watch them open for delivery last Friday, they had 130 tests run on Friday. They've got far greater capacity, which I know they're getting the people through for the tests now. But of those 130, they had 0 positive indications. And, if anything else, I took that as quite a good thing. But actually, what a great fillip for out there. And just to reiterate, you're absolutely right, Liz, that I think it's by Thursday this week, each district within Cambridgeshire will have one of these lateral flow test centres available.
Thank you for that, Mark. I've got something I want to touch on, Liz. I was speaking to a resident of mine this morning, and his 84-year-old father received a letter last week to go to one of the larger centres, the Grafton Centre. His son rang up Doddington to try and get him to Doddington and was told he couldn't. He had to go to the Grafton. I was under the impression that you could choose to go somewhere local.
I'm very happy to take that back to the CCG, Councillor Hay. I wouldn't want to comment on individual circumstances, but certainly the CCG are very keen to ensure that that vaccinations are accessible to people. But at the same time, there are a number of operational issues with where the vaccine's coming to and so on. So I wouldn't comment individually, but I'm very happy to take that back to the CCG and get some detail on it.
I very much appreciate that. My main concern was this gentleman had a family member who could take him there. There could be other elderly people who perhaps don't have that backup and so miss out on getting the vaccination because they simply don't realise that they can get help to get to a vaccination centre.
Absolutely, and no one would want that to happen. Everyone wants everyone who can to get the vaccine. So certainly the whole point of rolling this out with primary care networks is to have the vaccinations available locally, but also Adrian Chapman has been very engaged with setting up, ensuring community transport can be made available to people if they have difficulty getting to vaccination sites. So there are a number of ways in which the whole system is working to try and make sure everyone can get vaccinated. I think if we go into a little more detail with that individual case, then that will help us to solve any problems that may be occurring. So very happy to do that.
Right, thank you for that. Councillor Massey, you've got your hand raised.
I have, thank you. Sorry, I'm having some sound and microphone issues, so I keep having to come on and off and headphones in, headphones out. I keep trying to speak to myself to see if I can see if the mic's working, but I can see your faces that you can hear me, so that's good. A couple of points. First of all, I have already emailed my concerns that the impact of the second or third wave, depending on which way you want to look at it, of this virus on the NHS and diagnostic services is really important, I think, to note that we have got, from the first wave, we already knew the impact on patients who were waiting for medical services was quite great, and it just seemed to be we had a plan in place to try to address that, and then the second wave hit and things are a lot worse. So I'm just wondering what the planning and the thought process on that is. The second thing is whether or not it's come to the attention that although we have said that university students are not to return, and there are a lot of caveats to that. And I know in one particular college that 200 students have returned because they said they cannot work at home for many different reasons. Some of them is down to mental health. Some of it is down to the fact that they haven't got good Wi-Fi at home, or maybe they're sharing a room with siblings and they can't study, etc., etc. But if that's 200 from one college, and when we have many colleges here in the city, and least of all of the people that from in Peterborough, etc. My concern is that we have this feeling that we don't have any students, but the students who are returning, and this is information that's come to me, are now saying that because they're in their individual properties, they're not seeing everybody socially, so they all want to go into houses together, which you can imagine what the concern is there. So I'm wondering whether or not you've had any discussions with the universities about the students who have returned and their living accommodation, and whether there's a public health view on that.
Okay, thank you, Councillor Massey. I think that the first question on the NHS diagnostics and access would actually be probably a topic for NHS scrutiny if the committee wanted to look at that at some point in future. I think that's probably not one for me in a sense to respond on. It is the committee's scrutiny role for the NHS. But in terms of the university, yes, certainly we continue to a senior member of my team continues to attend the weekly Cambridge University Gold meetings. So we are very much keeping up with the issues that you describe. And it's not about a sort of national policy for a mass return of students outside those courses that absolutely have to be local, but there is this sort of, in a sense, drip of students who have particular reasons that they need to come back. So we are monitoring that carefully, and we know how many students there are in Cambridge, and are very much keeping up with those issues with the university. So I can reassure you on that, that we are monitoring that carefully, and at the moment are satisfied that the right measures are being taken.
Right, I can't see any more hands raised. So we will go on to the recommendation, and basically we're asked to note the progress to date in responding to the impact of the pandemic and note the public health response. And I think we've done both of those. So we're now moving on to agenda item number 7. Unfortunately, the NHS dental services, which we should have been receiving a report today, they've sent notice that they will be unable to attend our scrutiny today and sent the following apology to the Health Committee. With regret, as we are in Category 5 incident, our ability to produce a summary report and attend the meeting is substantially reduced. We ask for you to convey our apologies to Health Committee on this occasion. Following that, the scrutiny item will be postponed until the next meeting or until an appropriate time can be found. Therefore, instead, we will move on to the final item on the agenda today, which is the agenda plans and appointments to outside bodies and advisory groups. Members will have read the agenda plan as published. So, Rhiannon, is there anything you need to add?
Nothing to add.
Liz, Val, are there any other changes, updates you wish to bring to our attention?
Not for myself.
I don't think Val's on with us, is she? No.
No.
In that case, you will have noted that the date of our next meeting is on the 11th of March. We have reached the end of our current agenda, which only leaves me to thank you for your attendance and wish you a good evening. With that, I will now formally close the meeting, and I'd like to give up my thanks to all the officers who've taken time to attend today, as well as the members. Thank you.
Thank you.